Most people think RF microneedling is a miracle for skin aging. But if you start too late or you start too early, you could be wasting time and effort, or worse, seeing no results. Today, I'm going to break down exactly when RF microneedling works best after 40 and hidden mistakes most clinics don't tell you about timing. I've worked with hundreds of clients in their 40s and 50s, and the difference between collagen building success and disappointment often comes down to timing strategy. And yes, we have studies to back it up. We'll uncover the science behind collagen aging, common pitfalls that can derail your results, and a smart timing blueprint to get your skin firmer, healthier, without wasting time. Let's dive in. Hey guys, I'm Dr. Carter with Modern Body Clinic, and we are aesthetic specialists. This channel is all about transforming yourself in a safe and effective way. So why is timing so critical? Well, one of the things is that depending on who you ask and what studies you look at, our collagen creation starts to decrease anywhere from 25 to 30 years old. And certainly by your 40s, your collagen production has dropped anywhere from 25 to 30%. How this affects RF microneedling results is, how it works is by kickstarting your collagen production. But the response is slower as we get older. So how old were you when you started noticing maybe your skin is not tight as it was before? So pitfall number one is, believe it or not, starting too early. So when prevention backfires. Now, who this applies to is often someone in their either late 30s or early 40s, when you have minimal laxity, but you're expecting to see dramatic results. So your skin might not have enough laxity or low in production yet. So you invest time and you only see minimal results. So it's really about the expectation. Yes, we can certainly use it as preventative. You're just not going to see the results as well. So if you're in your early 40s and you have good skin quality, you actually may benefit more from an occasional maintenance session or even a lighter treatment like a hydrofacial until the collagen loss progresses. And again, mainly this is related to your expectation. Pitfall number two is starting too late. We don't want to chase results after we have severe sagging. So who this is going to apply to is someone in their late 40s, 50s, and you have deep wrinkles and significant sagging, and you're expecting a miracle or maybe expecting a surgical result. By the time we start noticing those type of changes, is related to volume, and our microneedling will not address volume. It's going to remodel your skin in regards to texture and laxity. So it will not lift heavy sagging. So if you have deeper sagging or deeper lines, you will certainly have a better outcome with microneedling if you address the volume, whether that's with a biostimulator like Sculptra or a dermal filler like Voluma or RHA, or even PRF. All these will address volume issues, but also you can even consider a surgical consultation. So the optimal timing blueprint, when will you actually see the match? Well, the sweet spot is really when you start to notice early laxity. You have fine lines and maybe you start to notice some texture changes, but this is before you have deep folds or really noticing sagging in nipples. And usually this is anywhere from mid to late 40s. Now, session frequency, you're generally going to do 3, usually 4 treatments to get the effect we want, and then followed by a maintenance. Usually just once a year is sufficient, at least with the technology we use. Now, the peak results of timing of seeing the results is anywhere from 3 to 6 months after the last treatment. That is going to be when we have the maximal collagen production. And so, yes, you have to be patient. Now, there are, maybe this is controversial around seasonal time. A lot of clinics don't want to necessarily do these type of treatments in the summer or our pills because we worry about hyperpigmentation. Now, if you are someone that is going to be indoors shortly after a procedure, I think it's totally fine to do it in the summer. And whether you do it any other part of the year, whether you do this or any other procedure outside the summer or the fall or winter, you still want to limit direct sun exposure in any event. Now, RF microneedling can transform your skin after 40. So ideally, if you hit that right window, what we call the Goldilocks time. We don't want to do it too early, and we definitely don't want to do it too late. So if you're wondering where you're on this timeline, our clinic offers complimentary consultations to assess your status and tailor a plan that will work for you. Check out the link in the description. Otherwise, hang around and check out one of these videos on